first trimester is finally over. From the morning sickness to the overwhelming tiredness to that weird metallic taste in your mouth, welcome to the second trimester of pregnancy, where things start to get really interesting. But your body is about to transform in ways that nobody warns you about, from the pregnancy brain to the growing pains. But today, we're breaking down the symptoms that you truly need to know, plus 6 red flags that means you need to call your doctor immediately. Therefore, if you're between week 13 and week 27 or supporting someone who is, let's make sure you know exactly what is normal and when you need to call your doctor. This video could be life-saving, so stay with me. Hello, beautiful ladies. Welcome back to this channel. If this is your first time here, I share pregnancy and baby health education, so you feel confident, informed, and empowered all through this journey. So let's now talk about the 15 second trimester symptoms plus 6 pregnancy warning signs that you should never ignore. So let's start with the symptoms that are caused by your growing baby and the shifting hormones. Number 1 is the round ligaments pain. As your bump grows, the thick ligament supporting your uterus stretches like a rubber band, such that if you cough, you sneeze, or you stand up really too quickly, you might experience a jabbing sensation in your lower belly or right in your hip. This is startling, but it's just your body trying to make room for your growing baby. Number 2, the return of energy. This is the honeymoon effect. The placenta is now fully functional and has taken over hormone production, and this greatly lifts the brain fog effect of the first trimester on you. This is the perfect time to start the nursery, to start shopping for new baby items, and get moving. But don't overdo it, because symptoms number 3 is waiting for you at night. Number 3, leg cramps. This usually happens in the middle of the night, probably because you turned or you try to stretch your legs. These are involuntary spasms occurring in the calves. They are often linked as a result of carrying extra weight or as a result of a lack of calcium and magnesium. But gently massaging the calves or trying to stretch your foot forward towards your shin could bring relief really quickly. So sorry, it's just part of being pregnant, and very soon it will be all over. Number 4, the glow and the melasma. Increasing blood flow can make your skin more radiant, and the famous pregnancy glow begins. But your hormones as well could trigger melasma and hyperpigmentation, causing some dark patches around your neck and some part of your face. Mine equally happened in some part of my legs. So it is all part of being pregnant, and I always say don't start any new skincare routine. Most times, once pregnancy is all over, you can safely use safe products to clean them. So maintain mild beauty products during pregnancy. Overlook the pregnancy and the melasma. It's part of the joy of motherhood. Once you're done giving birth, we will take care of that. Number 5, the linea nigra. That dark line that tends to run down your belly. It has always been there, right? Just that the hormones are currently turning the lights on and they now appear more visible. It is actually a beautiful marker of your progress. Now, the symptoms already mentioned from symptom 1 down to this symptom number 5 are mostly on the physical symptoms. Let's now talk about the hidden symptoms that can make you think you are losing your mind, especially symptom number 7. So, symptom number 6, pregnancy brain, is not a myth. Pregnancy brain is actually real. Your brain actually undergoes subtle structural changes in the gray matter in order to prepare or prioritize bonding and certain emotional processes. So if suddenly you're losing your keys or you're forgetting why you walked into a room, don't worry, it's just your brain busy upgrading for motherhood. Symptom number 7, vivid or bizarre dream. Between shifting hormones and interrupted sleep pattern, your dreams might become incredibly intense and even a little bit strange. I've explained this before in that video. This is simply your subconscious mind preparing for the big life that lies ahead. So expect more of movie-like dreams that feels incredibly real. This is quite a very common symptom. Have you experienced this before? Let me know in the comment section. By the way, where are you watching me from? Let me know in the comments, because I would like to know. Number 8, Nasal congestion, also known as pregnancy rhinitis. Ever felt like you have a cold that just won't go away? Higher estrogen levels plus increased blood flow causes the mucous membrane in your nose to swell. You might feel stuffed up or even experience some minor bleeds without actually being sick. Your nose is simply pregnant with you as well. I don't know, pregnancy videos, pregnancy health stories actually cracks me up so well because it makes me remember a whole lot. So, symptom number 9, bleeding gums. Your blood volume increases by nearly 50% during pregnancy. This makes your gum to be extra sensitive and prone to inflammation or pregnancy gingivitis. So if you see a little pink while brushing, it is just a gentle reminder to be more gentle and keep up with your dental flossing. It is actually very ideal for you to maintain a higher level of oral hygiene during pregnancy. Symptom number 10, heartburn and indigestion. As your baby grows, they push your stomach upwards. At the same time, your rising progesterone levels tend to relax the valves between the stomach and the esophagus, allowing or giving the stomach acid a chance to creep up. It's actually less about what you eat and more about the lack of space. It's actually a crowded space in there. So eating frequent but small meals at a time can help with this. And a glass of warm milk can sometimes relieve with the symptoms of heartburn, at least before you get to see your doctor. We are gradually getting to the best symptom of all in a moment. But first, let's talk about the social symptoms and internal shifts that no one prepares you for. And that brings us to symptom number 11. Number 11, backache. Your bump is pulling your weight forward, and that puts a lot of stress on your lower back. Your body is equally producing a relaxing hormone that tends to loosen up the joints in preparation for birth. And this can make your back feel a little bit more vulnerable than usual. They are all normal symptoms of pregnancy caused as a result of your increasing weight gain, increasing baby weight gain, and all of that. Number 12, increase libido. With the survival mode of the first trimester finally over, and with the increased blood supply or blood flow to the pelvic region, many women experience increased desire for intimacy, and this is completely normal and often welcome. And unless your doctor advises otherwise, fire on and have fun. It is all part of the golden phase of this second trimester. Symptom number 13, snoring. Even if you have been a silent sleeper all your life, that nasal congestion we talked about in symptom number 8 can make you a bit noisy and snore at night when you sleep. This is temporary though, but it might be worth investing an extra pillow for your comfort and to prop up yourself at night. Symptom number 14, the almighty Braxton Hicks. These are also called practice contraction or warm-up contraction. Your uterus is a muscle and it's practicing for the big day, that is labor proper. Think of your uterus as a student and preparing for a big exam. Instead of waiting for the last minute to prepare, it starts ahead of time. So every now and then, especially during this late second trimester and third trimester, it says to itself, let me rehearse, let me practice. And then your belly gets tighter, gets firmer. It can be a little bit discomforting, but not painful. And just as sudden as it came, it disappears. One key thing you need to know about this Braxton Hicks is that it doesn't have any rhythm, it doesn't have pattern, it doesn't last. Just like normal labor that your midwife can tell you, okay, start timing between this time and this time. Are you feeling the contraction? Once it comes, how many seconds did it last? All of that. Braxton Hicks is not like that. It just comes irredeemably and it goes. So it doesn't mean labor has started. So when next you experience a Braxton Hicks, just change position, drink water. If you were sitting down, just stand and take a little walk. If you were lying on your left, just change and lie on your right, and it will most likely go. Okay, no hospital bags yet. So long as you know that you have not reached your due date, you have not yet passed 7 weeks, and you're not leaking fluid, once you change position, it will most likely go. And if it bothers you, always make your doctor your best friend. Yeah, that is why I always say, even if you're registering in 2 hospitals, I always advise people to register in a renowned government-owned hospital and then choose any other hospital or clinic that is nearest to you in case of emergency. Always go straight to your doctor to confirm so that you will be sure. There's nothing as much as reassurance. Once your doctor tells you this is brass on his, go and rest. Symptom number 15, quickening, the very first kick, more like a payoff, the milestone that everyone awaits for. Between week 16 and week 22, you're going to feel the very first baby kicks, which are known as flutters. They feel like tiny gas bubbles or a tiny fish swimming around, and eventually these tiny movements, these flutters, is going to turn into unmistakable baby kicks that tells you that your baby is doing just great. Okay, pregnancy comes with a lot of changes, the expected and the surprising. And why so many symptoms are normal in pregnancy, there are certain warning signs that your body uses to tell you, please don't ignore me. And understanding the difference between these could help to protect both you and your baby. Now let's talk about the pregnancy warning signs, 6 of them that you should never ignore. The first on the list is severe or persistent abdominal pains. Why mild cramping can be normal in pregnancy as your body stretches to accommodate your growing baby. A pain that is worsening, that is sharp and won't go away, is not something to brush off, and it could be your body signaling to you that it needs medical attention. So are you having that persistent abdominal pains or severe cramps? Call your doctor immediately. Now, let's talk about vaginal bleeding. Mild spotting can be normal, especially in early pregnancy, which is usually called implantation bleeding. But any bright red bleed that is ongoing, it is persistent, and even accompanied with pain is not something to brush off. Please, personally, I say any form of bleeding during pregnancy should be reported immediately. I see it as a medical emergency. You shouldn't be sitting at home analyzing which one it is. Okay, so next, let's talk about severe headaches that won't go away. Occasionally headaches can happen, but these severe headaches that can be accompanied with dizziness or even blurred vision is a warning sign, and it could be a pointer to blood pressure problems. And please, you need to call your doctor immediately. It is a big warning sign, and that leads us to sudden swelling of the face, the hands, the legs, or even the eyes. Mild swellings can be normal in pregnancy, but any swelling that occurs suddenly and appears extreme, it could be a pointer that your body is under stress and needs to be checked. So call your healthcare provider immediately. Another warning sign that so many women overlook is reduced baby movement. As your pregnancy progresses, you're going to start noticing a particular pattern at which you feel baby movement. So if suddenly those movements decreases or feel so differently, it is a sign that you don't need to wait. You need to get checked because your baby might just be in distress. I already talked about what I did when for a whole day, almost a whole day, I didn't really feel baby movement in that video. You might want to watch it and listen for yourself. The link is going to be in the description box. Let's now move to fever and chills. A persistent fever in pregnancy is not something to sweep off. It might be a signal for infection that might affect both mother and child if not attended to or if not treated promptly. And finally, severe nausea and vomiting. Yes, morning sickness can be common and normal in pregnancy, but if it is so severe and won't let you hold both food and fluids down, it is a big warning sign that your body might be screaming for help. You don't need to panic. You just need to trust your instinct. If something feels completely off, it's better to get a reassurance than keeping silent and be sorry. So, to conclude, pregnancy can come with so many symptoms, but understanding what is normal and what is not and when to seek help can make all the difference between a healthy pregnancy and a potentially risky one. Trust your body, trust your instincts, and never feel bad or ashamed for asking questions or even too many questions. It's always better to be safe than to be sorry. And remember, noticing a warning sign does not always mean something is wrong. It simply means you're paying close attention. Now, I want to hear from you. How many of these second trimester symptoms have you experienced? And which of these warning signs surprised you? And is there something you would like me to throw more light on from my health professional point of view? Let me know in the comment section. And don't forget to like this video, click on the subscribe button, equally turn on the bell so that you don't miss out on any of our weekly uploads. And if there's anyone you feel this information is going to be of benefit to, Feel free to share and let them have access to this knowledge that can be of help to them. And I'll see you in the next one.